My name is Gary Hopkins. I am a health education specialist for the CDC Division of TB Elimination's Communication, Education, and Behavioral Studies branch. This webinar is hosted by the TB Education and Training Network. On our webinar today, we will learn about social media platforms, as well as discuss best practices, goal setting, and platform analytics. Our speaker today is Kevin Crooks. Kevin is a health communication specialist with CDC's Division of TB Elimination. Kevin and his colleagues manage the CDC TB accounts on X/Twitter and Facebook, and collaborate with other CDC divisions and partners on a variety of social media platforms. Before we get started, I have a few housekeeping items. Today's event is scheduled for 1 hour. The webinar is being recorded and we will post it on the CDC YouTube channel. As soon as it's available, I'll email the link to everyone who's registered, and you'll be free to share it with colleagues and partners. You may submit questions for the speaker by using the chat, Q&A, or hand-raising function, and we will respond to all the questions. After Kevin's presentation, we're going to have a question and answer session. So we will respond to all the questions at that time. So now I would like to turn it over to Kevin.
Thank you, Perry. So happy to be here. My name is Kevin Crooks. As Perry mentioned, I'm a health communications specialist in the Division of Tuberculosis Elimination on the communications team. Today, we're going to be doing an introduction to social media platform strategy and analytics. When we go through these slides, I'm going to be very formal because we're going to post these as a video later for those who might not have been able to join. And then when we do the Q&A portion, we'll get a little bit more fun. So for those of you who know me, I'm not a very buttoned up kind of presenter, but we're going to try our best here in these slides to get to this very important topic. For those of you I know, this is a topic that you know some about, but really want to drive home some of the best practices for TB programs, state and local CBOs, and show you what CDC does on social media as well. So let's get started. So here's our agenda today. We're going to be doing an introduction to social media platforms. Now, you might be thinking, I know what social media platforms are, but as you also know, they are ever changing. So we'll give you kind of a 2023 update about social media platforms. We're going to go into social media strategy and how to reach specific audiences. And then we're going to do some goal setting and talk about the time commitment that you might have to put in for a social media account or a social media presence. We're going to talk about budgeting and paid versus organic social media. We're going to talk about metrics and how to inform some decisions about social media using those metrics. And then we're going to end with some best practices. So let's get into an introduction of social media platforms. Let me just move this so I can see everything here. Okay. So we have a lot of different social media platforms, and it's important to kind of stay up to date with what the purpose of each social media platform is and the target audience of that social media platform. So let's just go into the big ones that we have on the screen here today. Let's start with Facebook, Threads, and Instagram, the first three columns over there. And the reason we're going to start with those three is that because they're all owned by the same company. We have to think of social media as also their big businesses. So the parent company of those platforms will take into consideration kind of the strategy and vision of those platforms. So Facebook, to start off, has 2.9 million active monthly users, an age range targeting about 25 to 34, but that varies definitely. The purpose is for building relationships and loyalty, and the downside is a little bit of a limited reach, meaning that the post that you might post, unless you're targeting a specific audience, might not reach who you're trying to get to. Threads is a newer platform, and it's more for public relations and text-based content. It's the purpose is for news and conversations, and some of the downsides are that you need an Instagram account to have a Threads account at this point. And if you start a Threads account and you want to deactivate it, it will also deactivate your Instagram account. Again, knowing that these are linked to the parent companies is important. Instagram has about 2 million monthly active users, an age range from 18 to 34, again, building relationships and community. And Instagram is mainly for images and videos, but you can have captions on those videos. Next, formerly known as Twitter, now changed to X. The purpose of this platform is for news and conversations, public relations. The age range is 30 to 49, but it's important to note that it's 68% male on the X Twitter platform. And the downside is that it's ever changing, as you see in the news. Pinterest has a pretty big following, 78% female. The narrow demographic is an important downside to Pinterest, but it's mainly for clothing, art, and food, some influencing. YouTube has about 2.5 million active users. So we have to remember that YouTube is owned by Google. So those are pretty closely linked, and CDC does post things on YouTube, as we will post this video after the webinar happens. It's pretty resource intensive because they're long form videos. To be 508 compliant, which most of our users here will want to be, it takes a long time to have transcripts and approved content through YouTube. LinkedIn is for building relationships and businesses. The downside is that there's limited interactions. It's mostly a one-way platform. You're getting out information, and the age range is a little bit later than some of the other platforms. And finally, we'll end with TikTok. It has about 1 million active users that have grown exponentially over the past few years. There's a lot of purposes, but it's best for building community. The downside is it is a younger, narrow demographic. So I've put red boxes around Facebook and LinkedIn today because I think that those platforms might be the most bang for your buck in terms of TB programs and local and state health departments. The reason I say that is because it's easier to target an audience on Facebook and LinkedIn. You can target healthcare providers, specific demographics, specific areas. And so I think that those two platforms are really stable at this point and also might be worth looking into. So what platforms do we use at CDC? In CDC TB, we have an X, a Twitter account, and we have a Facebook account. CDC has Facebook, X, Instagram, LinkedIn, YouTube, and Pinterest. And then the CDC director is on X, Instagram, and we also have CDC and Espanol accounts on Facebook and X. Those Spanish language accounts are important because you're trying to reach a specific audience. And again, CDC uses Facebook and X to reach that Spanish speaking audience. You can see that some government officials will have also all of their posts in different languages, or what they'll do is they'll post one in English and then have a thread of posts in other languages. So as you know, in our field, different languages are extremely important. Our strategy with languages are that we push up posts to those CDC and Espanol accounts from the TB account, and then we'll amplify them from there in Spanish. So let's get into social media strategy. The graphic here is from Hootsuite, which is linked at the bottom. And again, social media is a business. And so these are business objectives that look at social media strategy. What you'll want to do probably is edit those business objectives, right? We're not trying to turn customers into advocates necessarily. We're not trying to drive sales necessarily. So this social media strategy is a document that will outline your goals, the tactics you'll use to achieve them, and the metrics that you will track to measure that progress. So let's use the first one for an example, grow the brand. We would probably say increase awareness of TB is our business objective. The social media goal is awareness. The metrics illuminate our current and potential audience. And how we would track that is through followers and shares and impressions, right? How many people looked at the content that you put out there? If we want to increase awareness, then we're getting one-way communication out into the world about TB prevention, control, things you can do, resources. Now, another thing you might want to look at is turning a general public person in the general public into somebody who's interested or finds more resources out about TB. That would be more, you would want to have a goal about engagement, engaging that person. You want them to either comment or like or click on your website to learn more. And so based on the goals that you're trying to achieve, you can look at the different metrics that we'll go into a little bit later in the presentation. So the first thing you might want to do is a social media audit. A social media audit is a process used to measure the success of your current strategy through your accounts and networks. It identifies your strengths, weaknesses, and some next steps that you might want to improve. Again, there's a free template through Hootsuite that's linked here at the bottom. So this will tell you what channels you're already using. Where are you already active? You know, there's a lot of turnover in different organizations. And so sometimes platforms can fall to the wayside. We forget that we had an X account, or we forget that we started a LinkedIn profile. And it might be good to go back and look at all of those profiles and see what is going on currently. What other partners could you collaborate with? I want this education and training network to start off your social media community of practice, right? I want you to meet people and to learn from folks that will also be using social media platforms and can be your advocates on those platforms. If you have TB related content that you want amplified, who would you go to amplify that content on social media? You might come to us from the CDC TB accounts. You might go to the Centers of Excellence on their social media accounts, or you might go to other health departments or CBOs. So what other partners could you collaborate with? Social media is all about engagement and increasing your reach through others and helping each other. And then what other contents are posting what other accounts are posting similar content? You could look at our CDC TB accounts. You know, what are we posting? What kind of education and training resources are on there? What kind of messages do we already put out there? And how can you either amplify those messages, or what do you want to do differently from the accounts that are already posting that content? So this is a nice way to kind of get a baseline of where you are social media wise. If you do an audit and you say the only thing we have is our health department Facebook page. So what is that currently doing, and what do you want to do differently with your social media goals in the future? So let's talk about the current social media landscape and some things in 2023 that we might need to take into consideration when you're looking at your social media goals. So consumers need snackable content. It needs to be small, bite-sized things that are easily digested by your consumers. Really easy to understand graphics and short messages. Scientific journals and papers and long fact sheets are not going to do well on social media, because as you can tell when you're scrolling on your social media, if it's something that's really complicated, you're not going to stop and look at it a little bit more. You're probably just going to keep on scrolling right by. Americans trust people over businesses and governments. And, that was seen a lot in the pandemic. And we at CDC, one of our goals, which is what we'll talk about next, is to increase the trust that the American public has in our social media accounts and in government in general. But what some other accounts have been doing recently, like, for example, the Washington Post. The Washington Post doesn't just post news articles. They have somebody running an account that is the face of the business. And that's becoming more and more evident on big business accounts, is they have somebody who is a spokesperson for that organization that tells you the news or tells you different things, but you're talking to a person rather than kind of a brick wall institution. And we're also doing that at CDC with our CDC Director account. As we've gotten a new director over the past few weeks, months, they've been posting more and more videos one-on-one with the director to become more of a social media spokesperson to increase that trust. Unfortunately, there has been declining organic reach, which means if you just post something with no monetization or no money behind it, that reach is declining recently, and that is incentivizing paid advertisements on social media. Once again, these are businesses. This is they're trying to make money, and ads allow these platforms to keep going. And so they're going to prioritize advertisements in the algorithm over organic posts. I just talked about this a little bit earlier, but engagement with a human touch spokespeople, or just posting things that are people centered. This is our team at this TB program. This is this person that's doing an amazing work in TB prevention and control. People are going to be more excited to see things like that than they are, these are the updated guidelines of XYZ, and here's a long document about that. Social media, you need that human touch on there. And then also, it's important to discuss what matters. The TB community does really groundbreaking, amazing work every day, and the core values of public health need to be shown through that public health social media lens. Okay, so let's get into social media strategy. Here are some things that we try and do from the CDC side that you might want to think about when you're looking at your social media strategy. So tailor the content to your audience. Who are you trying to reach? Are you trying to reach healthcare providers? Are you trying to reach people with TB? Are you trying to reach survivors? Call out your audience in that post. Start the post off with healthcare providers, this, TB programs, this. Are you at risk for TB? ? Really call out who you're trying to reach in that post and be consistent with that. If your target audience is healthcare providers, then continuously post content for healthcare providers. You want to increase the trust of the folks that follow you to know that, oh, this is an account that usually posts for me, for healthcare providers, or, oh no, this is usually an account that posts for community-based organizations, right? You want to be consistent with that. Provide authentic content. Again, I'm going to say this a couple times throughout the presentation, but you want your consumers to think that there's a human behind your account, right? If you're looking at the CDC account, you want to know that the director has something to do with that account, that they're thinking about the videos and the messages that go through that it's a person behind the computer screen posting those things. And it should be reflective of your program or your mission. You should optimize your social media content. And that means standing out in a crowded news feed. Exactly what I was saying before, right? You're scrolling. What makes you stop and interact with that content? Is it a very visual graphic? Is it something new? Is it something exciting? What is really going to stop your users from scrolling to look at what you're doing? Some of this can mean adjusting the sizes of your images and your graphics to fit the social media platform. We can talk about this later, but there's specific sizes for each social media platform that, because they need to be different in some way, that if your graphic fits that size, it's going to be a little bit more attention grabbing for the user. If you can only see kind of part of the graphic, or it's a little bit off, or it's skewed to the side, that's going to make somebody scroll a little bit farther and also give a little bit less authenticity to your account. So you should engage with your audience. This is a difficult one. You should respond to comments, ask for feedback, provide opportunities to interact, and that engagement can help build trust. Now, social media is can be a very ever-changing, volatile space. So some of the comments you may not want to respond to, and you should have a comment policy to know which comments you hide. Anything in regard to hate speech or any kind of discrimination can be hidden. You can have those policies in place. But if you're trying to build a smaller community on social media, ask for feedback, right? Comment your feedback below, or if somebody responds and says, hey, I would really love this resource, respond to that person, maybe link the resource. Any opportunity to interact will help your social media presence. Experiment with new things, try out new ways to engage. Have somebody who might not be, comfortable with it and record a little selfie video for World TB Day, for example. You try a GIF or a moving graphic. Use current events or jump on to trending topics with your messages. Now, this one can be a little bit of a gray area. We do important work with TB patients and providers on a daily basis, and so we don't want to trivialize that work. So you should jump on to the correct trending topics, or trending topics that work for you. If you follow Johns Hopkins Public Health, they usually will jump onto the correct or more appropriate topics and use that to leverage their public health outreach. Use data to drive your decisions. And we'll talk about this a little bit before, but when you experiment with something, see how it worked. Use evaluation and the analytics to say, okay, this actually didn't do very well. So that was a nice experiment, but we're not going to do it again. Or, wow, this is doing really well. So how can we continue this momentum in the future using the data from those posts? Recognize social media as a critical part of communication strategies. So not all of you on this call are social media specialists or experts, but you might be working in communications. You might be thinking about communications, and you need to recognize, whether you like it or not, social media is a critical part of communication. That's how people get information. So right from the beginning on a communications plan, you should be thinking, maybe we should draft 2 or 3 posts to either push to other folks or to amplify on our channels to increase the communications of this resource. And then have a unified presence. So whether you're utilizing a health department or a hospital channel, meet with their team to ensure your shared goals and objectives. Or if you're, working with a community-based organization, talk to them about the presence that you're hoping to solidify on your social media platforms. Okay, so let's talk about the anatomy of a social media post. So there's 3 basic parts of it, right? It's your call to action, it's the photo or the video, the media that you're going to add to it, because all social media posts should have some sort of media attached to it. And then the copy itself, like what you're actually saying. And so let's take this, for example, on the right-hand side here from our CDC TB account. Without treatment, inactive tuberculosis can develop into active TB disease and make you sick. Okay, that's our kind of pull. That's pulling you in, right? That's the problem. That's something that could hurt you. Learn how to protect yourself and your loved ones against TB, and then there's a link. So I know that if I click that link, I'm going to learn something about how to protect myself and my loved ones against TB. Then the graphic says, think, test, treat TB, protect your family, talk to your doctor about testing for tuberculosis TB. Okay, so that link, and probably if I didn't click on that link, I might think, oh, I need to talk to my doctor about testing for tuberculosis. And that's a kind of an eye-catching graphic of a nice family. So you kind of want the problem. This disease will harm you. Without treatment, inactive tuberculosis can become active TB. Plus the context. This disease is preventable and treatable. Learn how to protect yourself. And then the solution, or what you're trying to get the person to do, talk to your doctor about testing for tuberculosis, or click this link, learn how to protect yourself. So either one of those things. Here's some do's and don'ts about that social media post, right? The most important thing right up front. We talked about how people are going to scroll pretty quickly. So you want them to get that first thing that you want them to learn right at the top. Use emojis. Emojis are 508 compliant ways to get your point across. If you're talking about a resource, use some book emojis. If you're talking about a video directly observed therapy, you can use a phone emoji or a laptop emoji. They're great ways to add something new to your post. Use line breaks. I think this is important. So I'll go back and show you how there's a line break, a space in between the sentences in our post. And that just breaks it up so it's not a block of text. Use bullet points and check marks, and you can also use emojis as those bullet points and check marks. Have a specific call to action. Use plain language. That's really important on social media, right? We have to use very plain language on all social media posts because you're not sure who is actually going to be receiving that information. And then again, define your audience, right? If it's for healthcare providers, call out healthcare providers. So maybe don't write a blob of text, right? Use those line breaks, use something a little bit shorter. Don't write a 5-paragraph essay, right? Nobody's going to read it, or you might read it, but your users probably will want something a little bit smaller than that. Don't just copy everything from the web. If you have a paragraph on your web, don't just copy that and then paste it over into social media posts. They're very different ways of communicating. Don't write in jargon and don't repeat the same message in the graphic and the post, right? If you're already saying it if in your graphic, you don't have to say it again in your copy. So now we're going to have a little bit of audience participation because I know you just don't want to hear me talk for 25 more minutes. So I want you to draft a social media post. I want you to go and think for 1 second about a sentence or two that you want folks from your organization to hear. If you were going on social media right now and you really have something that you want to get out there, what would your post look like? Use the chat, go in there, draft your social media post. It doesn't have to be perfect. It can just be a sentence or two. You can include a link if you want. You can include some hashtags if you want. But I want everybody to try and draft a social media post. You can use the chat or oh, the chat is disabled. Oh, great. Maybe if Desita's listening, we can get the chat to open up for folks. And we'll get that going here in a second. Thank you, Kelly and McKenna. It's great to see everybody here. Thank you for your participation already. This was going to be a great idea. So hopefully we'll get that chat working in a second here. If not, we can also just use the Q&A in a second. So we'll circle back on that.
I think she said chat is open now.
There you go. Okay, great. So now that the chat is open, I'm going to give you about a minute here to draft a little social media post. I'll keep this up and you better watch out because if you draft a really good post, you might see it on the CDC TB accounts at some point in the future. So just think about, oh, still no access to the chat. Okay, well, we will continue to troubleshoot that maybe. And if not, in a second, we can just use the Q&A button as well. We can just, okay, there we go. Now it's working. Okay, great. And while you're doing that, I'm going to show you an example of some of our graphics. So when you're thinking about the anatomy of a social media post, what you want a social media post to look like, when you're looking at graphics, you know, what really stands out to you? What is eye-catching? Some moving graphics, some important messages, bite-sized content. So I'll stop here. I'm going to let a minute go by here because I want to see some social media posts in the chat. Here we go. Now our graphics are moving. I'm going to take a sip of coffee while I get some posts in there. And don't be afraid to, write something and it might not be perfect. Social media is again about experimentation and trying new things and collaboration. So this is a good exercise, at least to get the wheels turning. Great. I'm seeing some awesome posts so far. Fear of the unknown. Learn what you need to know about TB. TB is still a thing? Question mark. Learn more here. I like that one. Do you have TB? If TB is preventable and treatable, why are millions of people still dying from it? Get the facts. Worried about TB? We have the solution. 5 things to know about TB. Great. Oh my gosh, I see McKenna added an emoji. That's like bonus points. Did you know you can be affected with TB and not have any symptoms? Exactly. Find a link for more information below. Kim never thought she would get infected with TB. The good news is that it's curable. Great. Many people have latent TB infection and don't know it. Learn more here. This is awesome. Latent TB affects our population more than you think. Learn more. This is awesome. Thank you, everybody, for participating. Now, I'm seeing a lot of one thing that I will comment on is like click here or learn more below or learn more here. The here word is not necessarily always needing to be in your post. You can just say learn more or access resources here. Now, we did get and I need to take this feedback into account as well, but learn more is overused as a call to action for sure. And we do it as well. So if we're trying to think of some more experimental things, access free resources or are you at risk? Learn more about your risk. Oh, there it is. I use learn more again. So we're all learning how to optimize our social media accounts. So start trying to think about different call to actions that we can use in these posts. But thank you everyone so much for participating. We're gonna move on here. Okay, so let's get into goal setting and time commitment, because I'm sure you're thinking, sitting there thinking, I don't have a social media lead. I don't have a communications person specifically for social media. So my pop quiz to you would be, why is your program active on social media in the first place? What are your SMART goals that are driven by metrics that you want to get out of your social media presence? Some examples of these goals might be, I want to increase the community engagement via social media. I want to grow our audience of followers and folks that learn about TB. I want to increase web traffic. That's a big one, right? You have something really important on the web that you want to increase your traffic to. This is a way to do that. Or you want to increase awareness. Being honest with yourself about your goals on social media and why you want to be on these platforms in the first place might help with some of your time commitment, because oftentimes we get really excited about social media and think, okay, I'm going to post a lot, and then other things come up and it's not really in your duty, and it kind of falls to the wayside a little bit. So be honest with how much time you want to commit to social media. Sometimes it might not be the best for your program right now to have your own social media accounts. It might be best for you to push up different posts to your hospital or to your health department Facebook page, or some other organization that you work with. You might want to push your posts to other folks. Remember that there's always people behind these accounts, and so we're always willing to help each other out and to cross amplify things from different accounts, rather than each working in our own silos and on our own social content calendars that might not get the reach that you're trying to get. So let's get into budgeting. Outlining your goals and the action plan will help you figure out where you need to spend to see those results. Now, the good news is that social media is free. It is free to be on social media accounts, and to post is free at this point, and we're thankful for that. The bad news is that social media platforms are businesses, which we've been talking about, and they prioritize paid content. So for our Think, Test, Treat TB campaign, this is from last year, 2022 into 2023, we had a paid campaign on Facebook, and you can clearly see the difference between our paid campaign on Facebook, the purple, spike all the way up to 1.2 million impressions, and our organic, free posts in the green on Twitter that got up to about 100,000, which is actually pretty good for an account with 7,000 followers. But that's the difference between a paid campaign and an organic campaign on social media. It's a little unfortunate, overall, that social media platforms are prioritizing paid content. But if you can find a way to find a little bit of a budget for social media, if you have a very specific demographic or very specific things that you need to get out there, it will be in your best interest to look at maybe some sort of monetization on those posts. However, you can definitely have a very successful social media account with no paid incentivized content on there. Okay, so let's get into best practices here. The first one is something that we talked about a little bit earlier. You should incorporate social media into all aspects of your communication activities. It should be in that communication plan for all products and items that you want to get out there. You should build out your social calendar and engage with others, right? It's not just posting and then leaving it and never going back to it. Look at what other people are posting. Can you share that thing? Can you comment on it? Can you do something that will engage with others? And that will help your engagement too. It's kind of like a snowball effect. If you engage with others, then the algorithm will help others engage with you. They want people on the platform. Analyze what content has performed well and on which platform. So think about and use metrics to see what has performed well and where it has performed well. Think about what kind of content tends to get promoted. So if you're a health department and they usually don't think about general public posts, they usually only do healthcare provider posts, make sure you're prioritizing that to be sent to those health departments. Prioritize partner engagement early and throughout all activities, especially during World TB Day. Use tools and the analytics on each platform and in places like Sprout Social, which is it's a management platform for a bunch of different social media platforms. You can also use Hootsuite, but you can also do those things on the individual platforms, and then send an evergreen content to partners for promotion. Email it out. Just email and say, hey, we're going to be posting this. Would you mind reposting? And again, that's about the community of practice in your social media sphere that hopefully we can start today. Okay, I've been talking a lot and we want to make sure we have a Q&A. So that was the main portion of the presentation. I'm going to show you a little bit what we do. I'm going to go a little bit quicker through these slides. Sorry, I've been talking so much. But if we want to go back to any of these things during the Q&A, we can. I just want to make sure that there's time for everybody to make a comment. And we might have a question right now. I'm going to hold that for a little bit. We're going to finish the presentation, then we can start the Q&A if that's okay. If you have a question right now, you can put it in the Q&A box and maybe we'll get an answer that way. Okay, so using social media metrics is essential to track the performance of your social media channels. So here's what we track. On X, we track the tweets, new followers, engagement rate, impressions, and profile visits. We compare that to the quarters before and the year before. This is a 2021 versus 2022 comparison, and we show we increased the amount of tweets, but we went down in the new followers. And so what does that mean for what we're doing and what we want to do going forward? On Facebook, we look at new likes on the page and impressions or the reach. Again, our impressions went way up in 2022 because of that paid campaign. On LinkedIn, on the right-hand side, you can see you can track impressions, engagement, and that engagement rate, which is the amount of engagements divided by the amount of impressions. Of the people who scrolled by, who actually clicked on it or clicked on a link or zoomed into your picture, that will all go into your engagements. So this is an example of our impressions. You can see we have a spike during World TB Day, and when we release our surveillance report, impressions are the number of times your content was displayed to users. That's just people scrolling by, seeing it, maybe not even reading it, but they saw it. This is engagement, the number of times someone interacted with the content. They clicked on it, they liked it, they reposted it, they commented. Again, you can see bumps for our World TB Day content, surveillance report, and Think, Test, Treat TB campaign. These might be important metrics to look at on your profiles. You can then kind of compare your engagement rate, right? So our engagement rate in 2022 was very good. That's something that we prioritize. The median engagement rate on X is only 1%. Of the people that look through content on X, only 1% actually click on it, right? Or do something with it. They usually just scroll right by. So in 2021, we had a 1.8% engagement rate. 2022, 3.5. So that's what we're trying to get to, a high engagement rate, people actually clicking on our content. What are some high performing posts on X? So when we released the Mantoux skin test video, we said, this is a new video, so it's new and exciting. Check out the new video and learn more about how to administer TB skin test and linked to it. The graphic is informative. We had about 1,000 organic impressions. Around World TB Day, we selected the Moulin Rouge company as one of our TB elimination champions, and that was a big amplification opportunity from CDC and from Moulin Rouge. We tagged the Moulin Rouge Broadway account. We hashtagged our World TB Day and TB Elimination Champions. We timed it with the event, and we got a lot of amplification from that. It's also an interesting post, right? So that's why, wow, that's so interesting that CDC TB is talking about Moulin Rouge and the combination of Broadway and public health. So with trending hashtags, video content, timing with the events, an interesting amplification from partners that can be successful. On Facebook, when we posted our TB Elimination Champions, it's people-centered. Again, they want to see people on social media platforms. Excuse me. Recognition of accomplishments is very important. And again, that amplification from partners. Video content does very well on these platforms. They are prioritizing video content if you have it. I know it takes a lot to get to that video content, but the platforms are prioritizing video content because that's what sucks people in. So World TB Day is a great place to jump off. If you're looking right now, it's October, and you're thinking, I really want to launch a new social media strategy, World TB Day is around the time that you want to do it because it's apparent and we can all share each other's posts and everybody's trying to engage in some kind of way in the TB community. You can see that we have a bump right around March 21st, and that lasts until about the 24th, 25th in impressions and engagement on both platforms. We were selected at CDC for the program post of the week because the graphic, our World TB Day graphic, stands out with color contrast and is large and bold. And the caption provides a great background on World TB Day and the struggles we still face. This caption is a little bit longer, but it does, it was on the CDC Gov account. So we want to prioritize very informative content for that account because it's going to get a lot of reach. Our CDC TB Elimination Champions graphics, they have the CDC logo, World TB Day. They show a picture of the champion, shows that it's a champion, and has the entity or the person. These are encouraged to share on their own social media platforms and on ours. And so the amplification from partners is really important in that communication strategy. This is a Instagram story that we posted on CDC Gov this year on World TB Day. It's very quick, right? Each year on March 24th, we commemorate World TB Day. Although preventable and treatable, too many people in the United States still suffer from TB. This World TB Day, learn how you can think, test, treat TB link. We got about 150,000 impressions. It's very simple. You want those Instagram stories that disappear within 24 hours to have a very clear call to action. Learn how you can think, test, treat TB. And this is our last slide, then we'll get into some Q&A. So overall insights, use each other, engage with your partners, promote each other, that increases the reach and the following of your content. Participate in awareness events, World TB Day mainly, but Heritage Months, Antibiotic Awareness Week, different things that affect the community, that will help you jump onto those trending topics and that will drive engagement. New materials that you have, education materials, posters, graphics, post those and share that they're new because that's new and exciting things that get amplified and put up on the algorithm. Paid campaigns will increase your reach and engagement, but again, think about your goals and your budgeting that will align with those goals. And then as the social media landscape continues to evolve, people-centered content is important, right? Survivors, healthcare providers, people. You want your consumers, the people that are looking at your social media profiles, to see people and engage with those people. If you want to celebrate your team, that's something that really does well on social media. Accomplishments and positive things will go a long way. Okay, thank you so much for your attention during this time. That's the end of the presentation for now. We're going to stop the recording.